Good morning, team. It's a beautiful day outside. So our patient presents with omphalitis of newborn, sesamoiditis, and Nintendo thumb. Let's get to diagnosing.
I think it could be a case of osteomyelitis, given the symptoms.
I disagree. It may be more related to a bacterial infection like Staphylococcus aureus causing septic arthritis.
I'm leaning towards juvenile idiopathic arthritis, considering the symptoms and the patient's age.
Well, I believe it might be repetitive strain injury causing inflammation in the tendons.
You're all wrong. It's gestational trophoblastic disease. We need to act fast. Prepare for a wedge resection. Lung.
Wait, are you sure about this? It's a risky procedure?
Shouldn't we consider other treatment options before such an invasive surgery?
I'm not so sure about this, Hawks. We should discuss the risks with the patient.
This seems extreme. Are you certain this is the right call?
Damn it. I'm the expert here. Trust me. This is the only way. Prepare for surgery now. Tracy, I need to discuss a procedure with you. I believe a wedge resection on my patient with suspected gestational trophoblastic disease is the way to go.
Are you sure about this? You have a history of misdiagnosing patients.
My years of experience should speak for themselves, Tracy. I know what I'm doing.
Your track record says otherwise, Hawks. I can't ignore the mistakes you've made in the past.
It's time to move on from the past, Tracy. This time, I'm confident in my diagnosis.
I'm not convinced, but proceed with caution. If you're wrong again, there will be consequences.
Trust me, Tracy. I've got this one.
This is not good. The patient is in critical condition. We need to think of something.
Just think positive thoughts. Right now I'm thinking about that new roller coaster that just opened up.
Thinking of something that'll help the patient.
Roller coasters are great to think about, though, when you're all better.
Can you avoid being willfully useless for one day?
You all are a disgrace to this medical profession. How could you misdiagnose gestational trophoblastic disease and perform a wedge resection on the patient? You nearly killed them.
Dr. Hawks, we are truly sorry for the mistake. What do you think the correct diagnosis is?
Yes, please tell us what you believe the actual diagnosis is, Hawks.
We value your expertise. Please guide us on the correct path for the patient's treatment.
We understand we made a grave error, Hawks.
Please help us understand the correct diagnosis.
You lot are a bunch of incompetent fools. I don't have time to explain things to you.
You know, patients' vitals are a lot like a roller coaster. They go up rapidly, then go down rapidly. But if they stay on track, they reach the plateau of wellness.
Legalizing cannabis in this state was a mistake.
No kidding. I don't make as much for my side hustle as I used to.
Shut the hell up.
So, how are things going with your patients, Johnson?
Pretty good, actually. We are making some progress with a few of them, but it's tough to see the others struggle.
That's great to hear. I've been dealing with this one strange case lately. Can't seem to crack it.
Oh, what's going on with your patient?
I'm not sure yet, but something just clicked in my mind. I think I know what's wrong.
Really? That's amazing, Hawks. What do you think it is?
I'll have to run a few more tests, but I have a feeling it's a rare genetic disorder. Sorry, I have to go check on something. Catch you later.
Wait, what? Hawks, where are you going? What about your patient?
The patient is not in the fucking cafeteria, Johnson, are they? Where do you think I'm going? I have a new diagnosis for the patient. It's not gestational trophoblastic disease, as previously thought.
Hawks, you can't just barge in here without proper protective gear. What are you thinking?
Yeah, you're putting all of us at risk, Hawks. This is highly unprofessional.
We have protocols for a reason, Hawks. You need to follow them like the rest of us.
Ignoring safety procedures is unacceptable, Hawks. It's reckless behavior.
I don't have time for that right now. During lunch with Dr. Johnson, we reviewed the case, and it's clear the patient has E5A.
What's the prognosis for E5A, Hawks?
Yeah, what are we looking at in terms of treatment options and outcomes?
The prognosis for E5A is poor. It's a challenging condition to treat. I can't believe I got that wrong diagnosis on gestational trophoblastic disease. It was actually
Congratulations, Hawks. I'm glad you found the right diagnosis for the patient.
I am as well. Turns out when we all work together, no illness is a match for my team.
Wellness is E5A, which from the sounds of it doesn't have a great prognosis.
Tracy, why are you such a killjoy? Did you miss the opportunity this weekend to tell a 6-year-old that birthday parties are just smokescreens to make them forget they're only another year closer to the end?
I'm not even sure how to respond to that.
You just don't say crap like that at all. It's demoralizing. You kind of just ruined my day with that.